Merthyr Tydfil, the area that currently holds the unenviable title of the highest rate of new COVID-19 cases in the UK. Cases there per 100,000 people have almost doubled in a week. It's these troubling rising numbers in Wales that led to them announcing a third national lockdown from the 28th. Last night, Northern Ireland followed suit, announcing a 6-week lockdown beginning Boxing Day to curb rising cases, leading to questions for leaders in Scotland and England as to whether they'll do the same.
Obviously, we're hoping very much that we'll be able to avoid anything like that, but the reality is that the rates of infection have increased very much in the last few weeks. So what we're saying to people now over this Christmas period is, think of those rules about the 3 households that you can bubble up with, the 5 days. That is very much a maximum. That's not a target people should aim for, and I think people really get this.
UK-wide figures today highlight why further lockdowns may be needed. The latest estimate of the virus's reproduction rate, or R rate as it's known, shows another rise this week. It's concerning, as any higher than 1 and the virus grows exponentially. At the current rate, on average, every 10 people infected will infect between 11 and 12 other people.
Well, it is disappointing to see that the R number across the country is now over 1, bearing and even up to 1.3 in London. So, and we are about to go into the bubble period of Christmas when we'll have more mixing. So I think that there'll have to be a very careful decisions made about whether or not the tier system changes and whether a more rigorous system has to be introduced.
Weighing heavily on Boris Johnson's mind will be areas like Kent, the current COVID-19 hotspot in England.
I had it last January. My daughter's mother and father-in-law both had it, both in hospital with it. My stepson has had it the last 2 weeks, first time out on Thursday. His partner has now got it. It's rife.
His best friend and best friend's son both died.
Both died, same week.
Yeah.
It's up to you to be sensible about things and say, well, we don't really need it this year. In a few months' time, hopefully come spring, we can go and meet people in their gardens or our gardens. We can sit 2 metres apart. We can have a cup of tea and a sandwich, a cup, whatever, and have a social.
Weather permitting.
Weather permitting, yes.
I am quite scared. I think especially Medway, because we're tier 3, and as you can see, I don't think many people are sticking to the rules, to be honest with you.
Just my family, literally my children and us, we all live in the same household. My parents are staying away. I need to be working, so I can't risk getting it, they can't risk getting it.
The government's scientific committee earlier suggested if you are seeing vulnerable relatives this Christmas, to stop all other social interactions from today. With 1 week to go, what once seemed easy and carefree, now a bigger conundrum.
Well, joining me now is Professor Liam Smeeth. He's an epidemiologist at the London School of Hygiene and Tropical Medicine, and he also works as a GP. Also joining us is Professor David Salisbury, a vaccinologist who's a former director of immunisation at the Department of Health. Welcome, gentlemen. Professor Smeeth, if I can start with you. We heard people in Anya Pop's report talking about it being rife. The figures are certainly worrying. When the PM says he wants to avoid a national lockdown in England, he's not going to be able to, is he?
I think he's right to leave his options open, but I do fear that we are heading in the wrong direction in spite of the tier system, and I would expect there to be the need for a lockdown, I'm afraid, after Christmas, yes.
And what should the restrictions on that lockdown look like?
I mean, similar to the recent circuit breaker we had, which did have an impact, but we started at quite a high level of circulating virus, so although it had an impact, it wasn't enough to bring it all the way down. But quite similar, so essential shops open, but really otherwise than that, people staying at home as much as they can, not mixing. We know these measures are dreadful for everyone, for young and old alike, but we also know that they work in controlling this virus and getting it back under control. So similar to the kind of circuit breaker we had in recent weeks.
OK, Professor Salisbury, the way out of this cycle of lockdowns is going to be vaccination. When do you see this cycle ending, and when will enough people be vaccinated?
Well, every vaccine campaign is entirely driven by the quantity of vaccine. And so until we know how much vaccine there will be week by week, we can't make any predictions about when this will actually have an impact on stopping the deaths and stopping the hospital admissions.
Well, so far the figures show nearly 140,000 people have been vaccinated in the UK. The government aims to get most vulnerable people and NHS workers vaccinated by Easter. Do you believe we're on track for that huge operation? Because there are concerns that actually we're not.
Well, the number of doses that have been given so far is a trickle, but they've been given in hospitals and hardly been given rolled out into primary care and into major vaccine centres. So until those numbers go from 100,000, which is a trickle, to millions per week, which is what we need and is a flood, we don't know how long it's going to take. We need millions of doses every week. The GPs vaccinate 1 million doses a week for seasonal flu. We need to better that by several times over to be able to stop the cases, stop the deaths in short order.
Liam Smith, you're nodding there. What do you think are the stumbling blocks to rolling out vaccination faster at the moment?
I think exactly, I agree. We need more vaccine, we need more centres, and we need it rolled out in the community. I think people are making good efforts. In my area, they're making really excellent efforts. At the end of the day, they're offering any spare doses to local health workers, and I was vaccinated last night. And I think people are making the efforts. We need millions and as quickly as possible, because really once we can protect the most vulnerable people, it'll feel very different in society and we'll be in a much better position. We just need to go as quickly as we can. It's a real national effort.
And as you've been vaccinated yourself, tell us what it was like, and perhaps you can reassure people who are a bit worried about it.
I would be very happy to reassure people. I know we developed this vaccine very quickly, as quickly as possible, but this wasn't done in a rush. This wasn't about winning a race. This was about going through the process of developing a safe, effective vaccine. It's gone through all the rigorous steps. The UK regulator, is a world-leading regulator, has adjudged it to be safe to be given to humans. I was delighted to have the vaccine. I'd urge anyone who's offered this vaccine to take up that offer. Having vaccination protects themselves, helps protect the rest of society. And it's really important we get that coverage up as far as we can to get this virus under control and end the real misery. It's a misery for everyone, COVID. It's been a misery for the old people and people who are sick, but also young people, people running businesses, everyone in their jobs. Vaccine is the way out of this. And I would urge everyone to, take it when it's offered.
Professor Salisbury, one of the things that's not clear is that those people who are vaccinated, we don't know yet if they can still transmit the virus to the unvaccinated. When do you think we might get answers on that?
I don't know, and that will depend entirely on the studies that are in place, following the people who have been vaccinated, making sure that they don't get infected themselves. And difficult as this is to do, trying to look at household contacts and whether they are still at risk when people in the household have been vaccinated. Difficult studies, but really important to do these.
OK, still a lot of work to be done then. Professor David Salisbury and Professor Liam Smith, thank you both very much for joining us. And straight after this programme, Matt Fry will be presenting a Dispatches special on the coronavirus vaccine and is it safe? Now, the first guidance has been issued on how to treat people suffering from long COVID, as experts warned that the long-term effects of the disease can be significant. As scientists try to find out more about the condition, they've managed to identify a number of key symptoms, from chest pain to fatigue and depression. And the NHS has set up scores of specialist centres across the country offering rehabilitation. Well, Jane Dodge has been speaking to one woman who's still suffering debilitating symptoms months after she got infected.
Too weak to walk very far, Claire Hasty has to use a wheelchair if she wants to go out, often dependent on one of her 3 children. She used to cycle to work every day, but her bike has been consigned to the garage since she caught COVID in March.
My life has completely changed. I worked 5 days a week. a busy single parent of 3 boys. I had a very active social life. I did volunteering. I sang in Birmingham Opera Company. I was just living life to the full the whole time.
These days, Claire rarely leaves her house.
This is a mattress I've put on the kitchen floor because on a bad day I don't have the energy to get upstairs more than once in a day, and I can't get through a day without having to sleep at least once.
Claire did manage to get an appointment at one of the 69 long COVID clinics in England, but it didn't provide her with any answers.
It was amazing to be validated and having people trying to help, but until the science catches up, they didn't know what to do with me. They say, we've got no explanation for why you can't walk.
New figures suggest 1 in 5 of those who've had COVID still have symptoms 5 weeks later. Guidelines published today say GPs should refer them to a specialist clinic after a month. But with hundreds of thousands of patients falling into that category, it could be a long wait for an appointment.
These clinics that have been announced, they're not new, they've been repurposed from existing services that were already stretched. So the waiting lists are immense. So by the time people get seen, they may have been living with things like lung clots or myocarditis, which is inflammation of the heart muscle, which can be dangerous.
James and his twin brother William will be 12 next week. They've had to grow up quickly in the last 9 months.
I hope that everything goes back to normal. It will make life a lot more quote-unquote normal, because this is kind of the new normal. But yeah, it's just I'm looking forward to that little bit of hope at the end of the tunnel kind of thing.
Despite everything, Claire remains an optimist, convinced she will eventually get better.